Well, I think first of all, the parents should react in such a way that they're natural and relaxed about it, and tell them that the children are going to be seeing a new friend that'll help them stay healthy, and mention too that the office is just for children, so it's a special place for them and them alone, and try to avoid using negative words and phrases, words such as pain, hurt, needle. If you can leave that alone, and we'll carry them through that, and we'll avoid using those words as well. The other thing to do is you could bring a child's favorite toy or book with them so that they have something familiar with them on hand. And another point or two is try to avoid having them overeat or eat too much. So because sometimes if they're a little nervous, their stomach can become upset, and we don't want that as well. We just want them to feel really comfortable. Well, keeping the children at ease, I think, is something that's very natural to us. First of all, we've had a staff that's had lots of experience. Almost all of us are parents ourselves. We point out all the highlights of the office. There's just different things in the office that we love to point out to them that the children find amusing. We offer a very relaxed, informal, friendly environment with a very positive approach. We bring the parents in with the child for their first visit and tell the children we're going to count their teeth. We show them what we're going to count their teeth with, the little mirror and the little pointer to help us count the teeth, and show them the light that we use to focus on their mouth so we can see, because it's so dark in their mouth. And then have them wear some sunglasses and go through the counting of the teeth. And then when it's all over, we tell them how many teeth we counted and talk to them and their parents in an informal way about what the things that we found and things that are important for both the child and the parent to understand for their own. First of all, if a child chips a baby tooth, it's not as important as chipping an adult tooth, but in chipping a baby tooth, it still is important to seek some help. First of all, don't panic, and then seek some help. Try to phone your dentist or phone our office, and if we can't be reached, the Children's Hospital usually has somebody on call, and they can tend to it that way. If it's an adult tooth, it's a bit more serious because the terms can be the circumstances and consequences can be far more reaching, and they can the tooth could die. They might need root canal, or they could lose a tooth depending how badly it is. So immediate attention to that is very important. Again, following the same regime, checking with your dentist or phoning our office, and if we can't tend to it, phoning the Children's Hospital and seeing the dentist on call there. If a tooth is knocked out, and then that's a little bit more serious. If it's a baby tooth, we generally don't put that tooth back in because it could jeopardize the health and well-being of the permanent tooth underneath. But if it's the adult tooth, then we want to get that tooth back into position as quickly as possible. If you feel comfortable doing that yourself, then rinsing the tooth out with milk or something like that, trying to avoid touching the root of the tooth with your fingers and placing it back in the socket from which it came, and trying to put that back into position, and then getting to a dentist as quickly as possible. If you feel uncomfortable doing that, just putting the tooth in milk and getting to a dentist as quickly as possible is, time is of the essence. Well, we've had a few patients where they say they didn't come down because of the parking, and they went to their dentist or dentist of their choice closer to home or at a more convenient location, and then on occasion, for these people that have come back to me, they've said that they weren't happy with the care and ended up coming back and saying parking's not the issue, it's the care that they want to give their children.